Hi, everyone, and welcome to our January research briefing. I'm Vanessa Weisford from the Celiac Disease Program at Boston Children's Hospital, and I'm really looking forward to discussing a study today about how the COVID-19 pandemic has affected adherence to the gluten-free diet. Even though the vaccines are here and are being rolled out across the country, we still have a long way to go. So it's really good for us to take a look at how the past year has affected the gluten-free diet. As usual, we have our amazing Director of Research, Dr. Jocelyn Silvester, here to discuss this study. The research that we're going to talk about today comes from Italy and looked at the perceived impact of lockdown on adherence to the gluten-free diet. The survey was completed by 1,983 participants, including both adults and children. So, Dr. Silvester, let's not bury the lead. What did this study find in regard to how people with celiac disease manage the gluten-free diet during lockdown?
So I think before we do that, I think argue how quickly this study came out, because research doesn't happen overnight. And it's really only been 1 year since the first cases of coronavirus were recorded in China. And it's been less than that since there's been coronavirus that we've known of in Europe. And so to have had an event, to have gotten a study approved, to have conducted the study, to have written the paper, and to have had it go through peer review gives you some idea of just how quickly everybody is moving on learning more about coronaviruses affecting us. I think we focus a lot on the vaccine, but really across the board, researchers have really been engaged in trying to understand how COVID is impacting all aspects of our life, including celiac disease. And so I think as a clinician, the results of the study weren't particularly surprising in that patients reported that they thought that they were being more adherent to their diet. And that's definitely something I see in clinic. And the reason for that is that people are going out less and they're getting less takeout. And so they're cooking more at home, and they perceive that they're getting less gluten when they eat at home.
Absolutely. Did this study find any difference between kids and adults?
No, it actually was fairly similar between kids and adults, which I think is not surprising, because really that is a lifestyle change that was, regardless of whether you were a child and an adult, really restaurants have not been as much of a thing across the board.
Why did so many people in the study see an improvement in their adherence?
So I think really what's important to note about this study is that this is reported adherence, and this is how adherent people think that they are. And what's really interesting, and maybe tells you a little bit about the people who responded to the study, was that 94% reported strict adherence as opposed to partial adherence before the lockdown in Italy. And that's really much higher than we find when we ask questions, which allow for things like accidental gluten exposure or rare times when you might eat something that has small amounts of gluten. And so I think the measure you use is really important. But even these people who thought they were strict at the beginning thought they were being more strict when they were under lockdown, which I think, again, tells us what we already know, which is that there's different degrees of strictness of a gluten-free diet, and most of us can be more strict.
Absolutely. So I particularly liked that people reported that during the lockdown, they tried more recipes than usual using naturally gluten-free ingredients. Do you think that this is one of the silver linings of COVID, that more people learned how to cook at home?
So this is really interesting. One of the things that we have been concerned about but haven't seen to the degree we were worried about is shortages of gluten-free foods. And certainly there were people who reported difficulty finding foods, and in clinic anecdotally I have patients who are finding difficulty with manufactured foods. But I think, as you mentioned, there's a plethora of healthy, naturally gluten-free foods, and generally when people have more time at home, it gives them more time to cook. And I think what was really interesting was that among children, when they looked to just variables individually, those parents who became unemployed were more likely to do this sort of cooking, which again, I think speaks to the time involved in trying to follow a healthy gluten-free diet.
Do you think that the lockdown has been long enough to bring about real long-term change in behaviors?
That's a great question, because behavioral change is one of the hardest things we all do. And I think it's very difficult to predict because we don't know what the world's going to look like moving forward. And so if a lot of restaurants close, then people will continue probably to not eat at restaurants. If restaurants reopen, then I think people like convenience and will go back to eating out at restaurants and will have the same perceived risk from their gluten-free diet. One thing that I'm hoping for is 30% of respondents, both adults and children, mentioned that they had skipped a celiac disease follow-up appointment during the lockdown. And it's important to note that 99% of these people were on lockdown, not quarantine. So these people could have gone to an appointment, but they chose to skip it. And I think it's very worrying that so many people are missing out on looking after their celiac disease. And so hopefully this is something that will not continue after the pandemic as people feel more comfortable coming out and coming to clinic. I also am not sure how much telehealth they have in Italy, whether the availability of telehealth might affect that as well. I know at Children's Hospital, we're seeing a lot of our celiac patients, particularly our follow-up patients, by telehealth.
Absolutely. Do you have any recommendations for patient families that are listening today for ways that they can continue to support their kids with celiac until the pandemic is over?
That's a great question, and I think it's really somewhat age specific, and there's aspects of that related to celiac disease, and there's aspects of that unrelated to celiac disease. And I think that our advice related to celiac disease really hasn't changed, which is that, like everything else in life, there's sort of a sweet spot for gluten-free diet adherence. And there comes a point of diminishing returns where the stress and anxiety related to trying to eliminate that last bit of gluten probably doesn't create a net health benefit. And so I think what's important is to remember that following a gluten-free diet is always challenging because it's always difficult to be 100% sure what one is eating. And just because one feels more comfortable at home doesn't mean that one should never go to restaurants when that becomes an option again.
Right. That's a really, really important piece of advice. So, Dr. Silvester, I want to thank you so much again for taking the time to explain this study to all of our listeners. And we really hope that everyone enjoyed today's research brief, and we'll see you again next month.